afternoon, everybody, and welcome to Liz Live. We have a really exciting show today. We are down at O'Toole Plastic Surgery in Shadyside with Dr. Jim O'Toole and with KADIE Fritz, who is his PA. And as you guys know, for the past week on Liz Live, we've been talking so much about self-image, body image, and what contributes to the problems that we all seem to have with those two things. So who better to comment on that than a plastic surgeon himself who deals with that every single day of the week, and his PA, his lovely PA, KADIE Fritz. And we've been talking for probably the last week on Liz Live all about this topic, and we've been waiting for you guys to come on, really excited. And one of the things when we're talking about image that I wanted to give you guys a chance to talk about is when we think of plastic surgery, a lot of times we think of nip tuck, or we think of these sort of, sensationalized views and images of what plastic surgery is really all about and all the procedures that you do. So can you speak to our audience about exactly all the different components of plastic surgery and what drew you to it?
Yeah, actually, plastic surgery started primarily as a reconstructive paradigm. The name plastic surgery comes from the Greek word, which is plastikos, which means to mold. Okay. So the primary mantra of plastic surgery is restoration of form and function. That's always been the calling. And then that it expounded into larger and greater things such as cosmetics, etc. But the original work in plastic surgery, which is largely attributed to an ear, nose, and throat physician named Dr. Howard Gillies out of Scotland. Okay. Originally, it was restoring World War I injuries. There were horrible facial injuries. The military people were in trenches. They would look up, and the face was the primary site of injury. So Sir Howard Gillies came up with very creative ways to restore facial form and function, and the specialty of plastic surgery spun off of that, essentially.
I never knew that. That's really interesting.
So the major components of plastic surgery are burn and reconstructive endeavors anywhere in the human body, hand surgery, and then, of course, cosmetics. And grown out of the extraordinarily impressive work of previous surgeons, you've taken what you've learned in the reconstructive world and it filtered down into the cosmetic world. Okay. So it's actually a very broad specialty, and sort of the joke among plastic surgeons is we are able to and willing to operate anywhere there's skin, from head to toe. And so there are subspecialties, there are sub-areas, but the specialty as a whole is extraordinarily broad.
Yeah, and it's really important. I mean, people don't think sometimes about all the trauma cases that you work with. I don't know if you do any cleft palate work or things like that.
I don't personally do cleft palate work. That is a very subspecialized area. I didn't even get into that. Cleft palate, there's a fancy term for cranial vault abnormalities called craniostenostosis. That's a specialty within plastic surgery where you reshape a child's head in infancy when their sutures have fused too soon. Clefting of various sorts, the typical cleft lip and palate that you think about. There's something called the Tessier classification. It's facial clefts that can be virtually anywhere in the face. Really? It's extraordinarily complicated surgery.
Yeah. So it's not such a narrow field. I mean, it's not just about nipping and tucking. I mean, it's so important in so many ways when we're talking about self-image and health. And KADIE, what drew you to the field? How did you get involved?
Honestly, what drew me to the field was the variety. I not only love helping women and men feel more confident by addressing what may bother them cosmetically, but also the fulfillment you get out of helping a cancer patient through some of the most trying times of their life. I mean, it really means a lot. And it's exciting because you get to see all sides of it. You get the fun stuff with the cosmetics, making people excited, but you also get to be there for people and help them through some difficult times.
Right. So as we were talking when we were preparing for the show, how there's such a big mental health piece to what you guys do. And, Dr. O'Toole, we had a really lengthy conversation about self-image of young women today, although I definitely think it goes across all ages at this point.
For sure.
But I know I have a lot of parents that come in that are concerned about their young daughters and sons now too, about their self-image. And then we also have just the mothers themselves coming in with all these different insecurities and I mean, plastic surgery is a wonderful option that I very much believe in. What do you see in your office?
We see, quite frankly, just about everything. And for me, that's what drew me to the field of plastic surgery, is the breadth of what you can do, but also the fact that it's a specialty that encourages novel thought. Here's a problem. This is the way it used to be solved. Let's solve it a different way.
Okay.
Like, come up with a creative solution to a problem, or come up with a solution that doesn't quite exist.
Okay.
The thing we're seeing a lot of now, and I talk to parents, I talk to patients, I talk to boys, girls, my own children. When I was a child, you really just had to compare yourself to the kids in your neighborhood, the kids at your school. That was your exposure. So it wasn't as challenging. We've always put an unnecessary importance on physical beauty. It's a societal problem we've had, but it's been since the dawn of time.
Right.
If you think of ancient Egyptian culture, they were extraordinarily ornate. It's been part of humanity forever.
Absolutely.
The problem now with young people, with all of the social media platforms, and I torture my daughter in particular, and I intentionally misname them. InstaChat's my favorite one. But the problem with this is you now have an international group of people that are posting. And when I was a kid, the only person that had a camera with a filter was a professional photographer in a lab. And 17 magazine had these unrealistic representations of young women. But that was the only unrealistic representation you really could see. So if you didn't have the magazine, you weren't comparing yourself to it.
Right.
Now, with the ubiquity of cell phones, the quality of the cameras, and literally millions of options to filter and change, young people worldwide have gotten extraordinarily good at taking pictures and knowing which pictures, what kind of light they look good in, knowing which filters are flattering to them, and they will take literally hundreds of pictures, but they will only post the one that's the most flattering.
That's right.
So now, if you're a young woman in Pittsburgh, Pennsylvania, you're not comparing yourself to 15 to 20 young women, you're comparing yourself to an international group of women, which is the analogy I use when I'm talking to like a young athlete, for example, is if every female soccer player under the age of 16 tried out for the same soccer team. 10 or 15 girls make it.
Right.
Billions don't.
Right.
When you're looking at these international platforms now, you're looking at millions and millions and millions of people you're comparing yourself to, which is absurdly ridiculous. But to use a track analogy, because I just had a track athlete a couple weeks ago, if every single female sprinter in the world showed up to try out for the track team, the overwhelming majority of the world is extraordinarily disappointed because they go home without being on the team.
Yeah, I mean, that's true. I never thought about it that way. And the other thing is it's being reinforced constantly because these young girls sit on their phone, and boys, not as bad, but they just sit on their phones over and over and over again all day long. And then when they come in for therapy, it's been actually really hard for me to even deal with how much they are hating their bodies and hating themselves at such a young age.
You have to start, honestly, what you have to do is you have to start breaking down that first before you even start getting into their attributes. And so the one thing I always point out to younger people is everybody has some physical attribute that's admirable. And so what you want to do is you want to embellish the admirable attributes and de-emphasize the others. That's really, cosmetics have done well. That's what you're supposed to do.
Okay.
But the first thing is making sure the expectations and the goals are reasonable. We often will see young women come in with an Instagram post from someone who's an influencer and say, this is the look I want. And they'll have completely different facial structure. That's not accomplishable. You shouldn't even. So that's a young woman where you say, unfortunately, that's not something we can do, and this is why.
Okay.
And this is why we wouldn't want to do this.
Okay.
And then what I often do is I'll take up pictures and I just Google bad plastic surgery, and I'll just show them images of things that can happen if you try to alter your look too much.
Okay.
And that usually gets them to start understanding, and if that doesn't help, if that doesn't get them to that point, I also will actually, because when people are posting pictures, they're posting the best representation of themselves.
Exactly.
The majority of people.
Sure.
There's obviously been a new trend recently where people are posting, hey, this is what I really look like, which is awesome.
Okay, I didn't know that.
But I say this to some young patients. I take pictures of myself when I was a serious triathlete, and I show them that me then and me now. I'm like, well, this is a picture of me, but I don't look like this at all. And so they laugh and they realize, all right, he's got a sense of humor, but it breaks down the whole thing. And then you have to start working on, hey, like, you have almond-shaped eyes. People pay a lot of money to have them. Let's accentuate that. But you always you need to have a person that has realistic expectations, and comparing yourself to the daughter of a supermodel from Czechoslovakia is just not a realistic.
So, like, I mean, from a psychological standpoint, you guys are getting all of these young girls in here, and how do you manage their expectations? I mean, what do you say to them? I mean, you kind of answered that, but what if they're so disappointed?
Well, when you tell them we're not going to do surgery and here's why, they are disappointed every single time.
Every time.
And so, but then you explain to them this is why we're not doing it. And if you get a sense of whether or not they're really ingrained in this, or whether it's something from an external source. And so that's the first thing you have to break down. Is it internal or is it an external source? Is there someone in school that's torturing so-and-so, and
Right.
that's why?
Right.
Then the next step is you have to look and see, is it a realistic expectation, or is it even something we should consider? And then you also will get a sense for people that actually have a real problem. Mm-hmm. And those people, I say, I work very closely with a PhD in clinical psychology, because I think it's important that you go talk to someone that can talk through people that have your specialty as well. Mm-hmm. To get to the root of the problem, work at the root of the problem, then come back to me. And the uniform thing I hear is, well, I'll just find someone else to do it. And I tell them, you can find someone else to do it. It's not hard to do, because there are people that have financial goals as their primary within this specialty, which is a problem. Right. And I tell them, I'm like, what this surgeon you're going to is going to say is, he can't do it because he's not skilled enough. I'll do it for you. Really? All the time. And then you're going to have an operation that isn't going to meet your goals, and you're going to have less money in the bank, and you're going to have surgical scars. So I'm really adamant about doing that. And I tell them, I'm like, look, if you haven't figured out, I'm a very straightforward, honest guy. It's really important. And the other thing I tell them is, I'm fully private practice, so I don't take a salary unless I'm doing something. So if I'm telling you not to do something that requires you to put a lot of money in my bank, I must have very strong convictions that it's not the right idea. That's right. And that usually then they have a sense of trust, and then you can talk them through it, and then usually you can get to the root cause of what the problem is for them. Okay. And on that point, because, as a therapist, I'm always looking for, where is this coming from? Where do all these self-messages come? And I believe that they don't really come from us as the individual. They come from society, culture, family, friends, spouses a lot. What are you guys seeing in this practice as far as your patients? I mean, where are they picking up these negative tapes that play about themselves?
I mean, honestly, I think social media is a big culprit of it. As much as I love social media, because I think there are positive things that come along with it, you can stay connected with people, you can learn about things you never even knew existed. That's right. Unfortunately, it also has followed a trend where aesthetics is posted about a lot on social media. And some of the content is really, really great, but some of the content is preying on people's insecurities, making them feel bad about things they shouldn't necessarily feel bad about. And so that is something where I think it's really important to, when a patient comes in and is talking to me and is getting a consultation, you want to, of course, make sure they're there for the right reasons, and you want to make sure they're doing it for themselves, not doing it because a friend pressured them into it, or because they had a recent bad breakup and they're feeling bad about themselves. You want to make sure it's the right time in their life. You also want to make sure that what they're asking for is appropriate for them, and not try to sell them something that isn't appropriate for them. And unfortunately, like he touched upon, there are people in the plastic surgery field who will sell you a procedure that you may not necessarily need. So that's something that education is a huge thing with us. We will not touch you until, we make sure that you are well educated and understand what you're getting yourself into. Right, and I've been a patient here for years, so I know that that's the truth. And that's something that I trust you guys with my life. And so I know that if I'm doing something, that whatever's being done is to my benefit and it's done ethically. Like when I was attacked by the dog and you had to repair my scar, that was a trauma that I think a lot of times people don't think about those things as that's a plastic surgeon's issue. Yep. And so, the take home is the most important thing if you're talking about surgical endeavors. It's the right person, right surgery, right time. All three of those things have to be met. Oftentimes we'll meet young women in particular, and younger men to a lesser degree, but it's becoming more prevalent. Mm-hmm. We'll meet them. We know the right operation. Like, for example, we have a young lady that's been waiting for a couple of years to do some minor touch-ups to her nose, a minor rhinoplasty, nothing extravagant. Okay. But she came in
too young. She wasn't skeletally fully grown, so working on bones when they're not at full skeletal growth is not really appropriate and should be avoided. And she also had an abnormal and almost obsessive compulsion with it, to the point where she would show all of her Instagram pictures to us, and every single time it was at an angle that she didn't like, she would fixate on that and not even pay attention to the rest of her face, which is quite beautiful. And
don't we all do that?
We do, but so what I have been working with her and her mother primarily is pointing out the facial features that she does have. And part of her comparative issue is her mother has a very, very thin, dainty nose, and she doesn't carry her mom's nose. She carries her dad's nose. And so it's like, it's rough for her, but I have pointed out to her over the last couple of years, A, we need to get a little bit more mature, we need to get a little bit older, but B, your other features are outstanding, and all we have to do is de-emphasize a little bit of the nasal bridge, a little bit of the tip, but right now, so it was actually supposed to happen this summer, but she's now gotten to the point with all the COVID going on, she's actually a much more confident young woman.
Wow.
So at this point in time, she wants to hold off until she's ready for college. So we've solved her problem, and her mom said she doesn't fix it anymore.
Wow. So there's such a huge mental health component to this. So, what do you say to parents who have a daughter or a son that really is fixated on something about themselves, and they're asking the parent, can I please go see Dr. O'Toole? What do you say to them, and what do you tell them to do? What's the experience here?
It depends on what the complaint is, depends on what the issue is. And then it also depends on the chronological age, but also on the maturity level, because you can take a 15-year-old who's extraordinarily mature, and you can take a 15-year-old who isn't going to be mature for another 15 years, typically in boys. Typically in boys. So the first thing is to find out if it's a young boy or girl, or older as well, is their fixation reasonable? Then the second thing is, and this is a big thing, is are they avoiding things that would otherwise be age appropriate because of it? For example, if it's a young man who has minor gynecomastia, which is a term for sort of breast development, will he go to the pool and take his shirt off with his friends? If he goes to the beach, does his shirt ever come off, or does he wear a swim shirt every day? So then you start to ask about questions about impact on the quality of life. Are they avoiding age appropriate things because of this? Well, if they are, that's a problem for longitudinal development mentally. So then that to me is one of the triggers to consider doing something. If someone's otherwise seems very reasonable, but are avoiding age-appropriate behaviors and activities, you need to step back, you need to actually talk to the child or the young adult and find out why they're avoiding it and what it would take to have them not avoid it so that they can live their lives. Because that then allows you to know you're solving actually a problem, not just a cosmetic physical something, but you're actually solving a problem in the structure of their life.
Wow. Yeah, that's a really interesting way of assessing it. So do you see, do young boys come in, and what are they asking for?
The most common thing for younger men is liposuction, primarily chest. That's the biggest thing, and then we do see young male athletes that have had nasal fractures. That's a pretty common thing.
So is it majority women?
It is. Plastic surgery historically has been about 80-90% women. Over the last decade, men have got more involved, and there's a little bit more of a trickle down to younger men now. And the other thing we see a lot of in younger men is skincare. They're actually starting to pay attention to how they take care of their skin.
Acne. That's a big one.
Yeah. Okay, and that's sort of where KADIE comes in, because I know that's her specialty, right? So what can you offer young teens who are wrestling with?
It honestly depends on what their struggle is. I mean, if it's mild acne that can be controlled with over-the-counter products, we always start there, because everybody who is young, they have financial concerns, so you don't want to be selling them a $1,000 skincare line, they can't be consistent with. So, it really depends on where they're at in life and what their issue is. If they're young, finances are concerned, and the issues are mild, then they can be controlled with over-the-counter products. And we have tried lots of them that are out there to know which ones work and don't work. I mean, all the products that we suggest are things that we've tried ourselves.
Got it.
If their acne is worse, and it can't be controlled with over-the-counter, well, then we might consider some of the prescription topicals or oral medications, or we even have a laser that can target acne too. So there's lots of different ways to go about it. You just have to see what's right for that.
Peels.
Yeah, and the peels. Yeah, so you have to see what's
I did
good.
that. I did the V-peel.
Yeah, so it just depends on the patient. It's very individualized because there's acne is a great example because there's lots of different ways you can treat it, but what's best for that
person.
Exactly.
So you guys have a lot going on here, I'll say. Now, what I would really like to get into is I was reading a little bit about you prior to the show, and what I learned that I didn't know is that you sort of pioneered or innovated some procedures for, and correct me if I'm wrong, but in breast reconstruction and also body contouring, which I really want to talk about too. So tell us what you did.
So the thing, the biggest thing that I personally was involved in was helping be part of the genesis of what's called the oncoplastic approach to breast cancer.
Okay.
And I'm not like the progenitor. However, when I was in New York, when you're a fellow, the one thing you have tremendous benefit of is you train with a lot of different people. So you see a lot of different perspectives.
Okay.
But the other thing is you also get put on a service. For example, you will be on the breast service. If you're on the breast service as a plastic surgery fellow, you will see a cosmetic breast, you'll see a reconstructive breast, you'll see it all, and you'll see it all on the same day.
Okay.
And so one of the things that occurred to me back in 2006-ish, I was in clinic and we had seen a cosmetic patient, and I went into the next room, which was a cancer patient, which wasn't cancer, she was BRCA2 positive, one of the genetic susceptibilities. Okay. And we had done standard mastectomy with a standard mastectomy incision with a tissue expander, and it was one of those things where you're supposed to be like, all right, everything went well. She didn't have cancer. We had seen things on imaging that we were concerned about. We tried to biopsy. It came back equivocal. Long story short, everything came back from a surgical standpoint. All the surgical endpoints. Surgery went well. There was no infection. We lost no skin, no implant loss, no cancer, no need for chemotherapy. So
oh my God.
From that perspective, it was a home run. So if you look at just from clinical endpoints, and clinical endpoints are where we oftentimes fail in plastic surgery.
Okay.
The clinical endpoints were all admirable. I went in to see the young lady and she had her head down crying softly, and I said, what's wrong? And she said this without looking up, and I said, what's this? And she said, this. I look like a 14-year-old boy who got attacked by a lion.
Oh, wow.
So when you have that experience, it shocks the system.
That's traumatic.
I walked out of the room to collect myself because I didn't know how to address this young woman who was in her 30s, a very beautiful young lady, and I wasn't the attending, but I was involved in her care, and I knew I made her miserable. So it makes you uncomfortable. So I went to the resident's computer, and I was just looking through images in our breast reconstruction because our program director was very dogmatic about putting all the images on the computer because the resident that may have done the operation with the attending will move on, and then 3 months later that woman comes back in. If you don't have her photographs, you don't have a frame of reference for why she may be unhappy. As I was flipping through all the reconstruction pictures from implant-based reconstruction, I realized every single one of them had that central chest scar. And at that moment, I had an epiphany. I'm like, we work our backsides off in cosmetic breast surgery to hide the scar from women. But in breast cancer, we basically say, F you, this is the scar, you get live with it. Mm-hmm. And so I went out to one of the attendings that was younger and I knew was very bright and willing to think things differently. And I said, hey, look, we have all these incision patterns we use for cosmetic breast surgery. All of them geared in attempting to hide the scar from the women. He goes, yeah. And I said, well, in mastectomy and breast cancer patients, we put the scar wherever the heck we want. And then the woman gets to live with it for the next 40 years. Wow. I said, so does that make any sense to you? And he goes, it doesn't really. And so that moment I had the thought of like, why are we not using a cosmetic? We know the science behind the treatment of breast cancer. It's very intensely studied internationally. Okay. Once you know all that, then why not try to use an approach that allows for the best cosmetic outcome while not compromising any of the oncology? And we started doing that when I was a fellow back in, I think it was 2006. And it's been something we just kept working on, embellishing, and we've continued to do here. And quite frankly, a lot of the stuff I've learned from the reconstructive side that allows a reconstruction to look cosmetically appealing, I've stolen good ideas from that and taken it over to the reconstructive side. And from the cosmetic side, vice versa. There was always this big distinction between reconstructive breast surgery and cosmetic breast surgery. Well, you're still dealing with a woman and her breasts and the quality of life she has after surgery and everything's over.
Wow. Thanks.
So it was really, I mean, it was a really powerful moment for me because it was one of those things where I felt as though I got hit in the back of the head by a board. Like, why didn't I think of this sooner?
Yeah, but I mean, maybe in some ways, like, people weren't giving women enough, how do I say this? Maybe people back a long time ago weren't as connected to the female experience as you were, or are, or were becoming.
I think they for sure weren't, and I think, honestly, and I hate to say this, I think one of the problems is surgery has been historically very male-dominated.
Yeah.
And so when the specialty is very much dominated by male sensibilities, the female sensibility is not really involved.
That's right.
And so then when you step back, and that's, one of the main reasons that I brought KADIE onto the team, is I can be the most conscientious guy in the world, but I cannot have a woman's sensibilities because I'm not female. And I tell every woman this and every patient I take care of. But to step back, and the other thing that we've lost sight of in a lot of medicine is you look at clinical endpoints again. What was the tumor stage? How did the operation go? Did she have to have chemotherapy? But what gets lost in the shuffle is the quality of life afterwards.
Right.
And so I do a lot of revision of breast reconstruction work because a lot of women are left unhappy. And so the questions I typically ask is, have you worn a bathing suit since surgery? Have you worn a summer dress? Will you throw a camisole on to run out to the grocery store if you forgot something? Or will you just run around with a tank top on? Have you ever done that? And if you haven't, well, now we've got a problem because you are not living your age-appropriate life.
Wow. Yeah, and I even used those assessment methods that you taught me when we were meeting last week in my practice ever since, and it's really helpful because I was asking more directly, like, what do you not like about yourself, or and
Yep.
What you guys taught me was like a softer approach. I'm kind of direct, but I said, what won't you do, or what won't you wear, or when do you find yourself most uncomfortable, and it elicits. It's a softer approach at getting people to really self-reflect and think about.
Well, but the other thing, in my opinion, I believe this very strongly, is it tells you what is inherently the real problem.
Right.
Like if you have a 16-year-old boy who goes on vacation with his family every year, goes to the pool every year, and does not take his shirt off, or takes his shirt off and immediately jumps in the pool or jumps in the ocean, he's uncomfortable with something about his physical form. So then we say, okay, we know there's something about your physical form. We know it's not your legs because you wore a swimsuit. We know it's not your face because you're not wearing a big hat. So then you say, all right, then once you get to know them and talk to them a little bit, then you say, so really what is it? Let me know. And then you can also, there's little tricks like, for young women in particular, because they all take selfies, I will ask them.
How many filters did you use?
Well, no, not even that. I ask them, I'm like, what position do you put your hand in and how do you take your photo? Because they do that at certain angles to hide something or de-emphasize something they find unappealing.
So why does everyone want to take it
because
this way?
It's thinning,
Okay.
and if you show more of a body shot, it elongates the body as well. But when a person will consistently take a picture from one angle and one angle only, and they all know the angle they like, you can literally slide around and look at them from that angle and see what they're not seeing. And then the other thing I also have to tell people, and I tell them all the time, I'm like, the thing you have to realize, the only person on the planet that can't see your face in 3 dimensions is you.
That's wild.
That will change as technology improves, but the reality is, so I tell everybody, I'm like, don't look in a makeup mirror or go like this right up to a mirror and say, because if every one of us does it, and if we're not 22 and gorgeous, we're going to find something we don't like.
I did that this morning.
Yeah.
Look at yourself
So
in conversation.
conversational distance, because that's the way the rest of the world sees you. And if someone is inside of your conversational distance, in all likelihood you let them there, and so then it doesn't matter.
I see.
The imperfection and impurities are already overlooked by that person, so then it doesn't matter.
So this must be very helpful and to explain to a prospective patient, so they have a better sense of what really what's really necessary, rather than trying to jump off the cliff and do really extreme procedures.
Yeah, no, you focus on, so like I said before, you embellish a positive feature, you de-emphasize a negative feature. And the key is to finding out what features they like, and then you can teach them, like, for example, if it's their eye shape, then I'll have KADIE run in and talk to them about ways to do shading around the eyes that embellish your eyes more. Which is something I can't possibly tell someone.
Okay.
So having KADIE, well, and then if there's something that they don't like that they want to de-emphasize, we can tell them the easiest ways to de-emphasize it. Mm-hmm. And ideally, it's a way that's reproducible, cost-effective, because, if you have a 17-year-old girl and she's got a problem because she doesn't like the way her chin looks, she's going to have that chin for a long time.
Right.
So,
now, do you guys do a lot of trauma work?
we do. We don't do as much as we used to.
Okay.
And that's frankly by design, because it's
It's a hard life.
It's very I mean, I have a wife that I love. I've got 3 children. Katie's got a fiance that should have been a husband, but COVID has struck twice. So I don't do as much as I used to. I will do some late stage burn reconstruction to alleviate contractures. There are some neat ways to do that. I did a burn fellowship as well, so it's something I do from time to time, but I'm not heavily involved. I don't take call at any of the trauma hospitals anymore because it's too difficult to have.
You do a lot of dog bites, though.
I do a lot of dog bites.
Yeah, you did my dog bite. Thank God.
Well, I do a lot of children lacerations too.
Lacerations, a lot of that.
I'm actually a child at heart, and I can usually get through to little kids and calm them down. So that kind of stuff, yes.
Yeah.
But major amputations and that kind of stuff I haven't done in years.
So I have so many questions that came to me from my viewers. So I don't even know where to begin because now I want to kind of shift into some of the modern day procedures that you're doing for more the cosmetic side. Okay, if that's okay.
Absolutely.
Okay. So what can you tell us? What is body contouring? I saw you were also innovated something with that.
I was the first person in the country fellowship trained for body contouring after weight loss.
Unbelievable. Okay.
So what it is if someone in the weight loss world, if someone does extremely well with the weight loss world, whether it's by diet and exercise or the surgical interventions, human skin has the ability to contract to a certain degree, but it gets to the point where it just no longer is. And so these folks get rid of medical problems like hypertension and diabetes, and increase their life expectancy by almost a decade by losing the weight, but they're often left with extra skin in places that they don't like. And there's some characteristic findings of the head and neck, the arms, the legs, the abdomen, the breast. And so there are different ways to solve those problems, and we used one of our sort of breast cancer approaches and an older approach I learned for a breast surgery to do a newer version of a breast lift in a person who's lost weight that is extraordinarily reliable, uses the more modern vertical incision pattern, not the more classic wise anchor incision, and allows for recreation of what appears to be an augmented breast in a lot of women. Now, in some, they don't have the volume, it doesn't quite work. And that's something you just have to have the conversation with the woman. Say, hey, look, this is what the volume we would have if we did this approach. And if they're going to be happy with that, great. If not, then we have to say, all right, we have to consider other things.
So you can do body contouring, that's the arms, legs, everything, anything.
Head to toe.
Wow. Okay. And then, so liposuction is when you actually, I know you go in there and suck it out.
Yeah, you can sugarcoat it. It's a metal stick under the skin. It's done by design, and there's some subtleties and nuances to doing it well. The thing that's nice about liposuction, especially if it's employed in the right setting is if somebody's otherwise generally fit, they have problem areas, in particular problem areas that are found over tissue that doesn't have a lot of biologic activity. For example, the hips, the outer thighs, inner thighs, the love handle area is what I'm referring to with the hips. Those are areas that are sitting over top of tissue that's not very biologically active. Okay. So you're over a bony crest, you're over tendons on the inside of the thigh, and you're over the hip bone on the outside of the thigh. Because those areas don't have any tissue with high metabolic demand, it's really hard to get rid of that fat once you have it. That's why those are classic problem areas.
And is that why we sag in those areas?
Well, over time, it does. There is a stretching out. So between the skin and the underlying fascia, which is what envelops the muscle, there's basically a fibrous connective network. And when you stretch that out, it doesn't have any contractile capabilities.
Okay.
So liposuction is best employed hitting problem areas. It's not a technique for weight loss. It's not going to help diabetes. They actually studied that back in the 80s and 90s, large volume liposuction on early type 2 diabetics, and it didn't do anything.
So that's something that, just to be clear to the audience, like if you were thinking about liposuction as a weight loss regimen, not. So if someone comes in here and they have, let's say they have 50 pounds to lose, and they want to get liposuction, would you say, hey, first I need you to go on a diet and lose X amount, and then I'll do it?
It depends. Well, in part it depends on their body morphology, the areas where they're storing the fat. Also depends partially on their goals. But if they say, hey, I want to lose 50 pounds, what I tell them is, all right, then we go into the nutritional background. Like, are you eating breakfast? Are you eating lean protein? Are you limiting carbohydrates later in the day? Are you not drinking calories? That kind of stuff. Because if they have a definitive goal, I tell them, if you weigh 100 80 and you want to be 130, I first tell them if they're the type of body that's reasonable. I will tell them if it's not a reasonable goal for them, that that's an unrealistic expectation, an unreal goal for you. You shouldn't want that because you're going to have to be unhealthy to get there because certain people just don't have the structure for that. So the first thing is saying, yes, your goal is reasonable. Or conversely saying your goal is unreasonable and that's not something we should shoot for because you can only get there if you're unhealthy. And then I say if that's really your goal, I can tell you some ways to facilitate weight loss. You do this, and then we'll do the liposuction when you're as close to your ideal goal weight because now we're tailoring it to the body that you want to have.
I see. Is weight loss, is that something that you have to do for a lot of different surgeries? Like I've heard for facelifts sometimes.
We do a lot of the surgeries that we do, breast reconstruction, breast reduction, higher body weight, and abdominoplasty in particular. Higher body weight has a much higher complication rate.
Okay.
And so I often will counsel people like, this is where we want to be relative to your height. This is the Mason-Dixon line of where surgery is safe. So we need to find out whatever we can do in a healthy fashion to get below there.
Okay.
And if it's a procedure like a tummy tuck, for example, or a facelift, if somebody is 50 pounds away from their goal, but they want the surgery sooner, you have to explain to them that if you have the surgery done first and then you lose the weight, it's going to affect the results and not in a positive manner.
Yeah, the skin's going to loosen.
Yeah, you want to make sure that they're close to their goal weight. Maybe they don't have to be exactly on target, but at least close enough, because if they're way outside of their goal, then it's not going to help their results.
I see.
And that's when I literally will tell them, like, if you want to make an unsolicited donation to my kid's 5 to 9 plan, you're welcome
Bring
to.
Bring it on.
But it's because the other thing is these things can be financially problematic for people, right? So as a practice, we very much discourage financing for any cosmetic anything.
Okay.
If you're going to finance for your car, if you're going to finance for your home, things that are essential to everyday living, that's fine. I don't really like the idea of financing in plastic surgery. A lot of people use it, but I just think that's you're putting someone at a financial risk for a return that if they just simply squirreled something away, every so often into a little me fund, you then can pay it up front and you don't have any finance charges and fees over time. So
that's smart. You guys really do. You're very ethical, and I appreciate that. And that's hard to find. Mm-hmm. It's hard to find. I think all your patients know and love both of you, and really appreciate the honesty and the ethical decision-making process, because I think people are coming to you so vulnerable. Mm-hmm. And
that's the one thing that we try to keep in the forefront of our mind is the fact that everybody that comes to us is vulnerable.
Very.
And what I mean by that is if you come here with a breast cancer diagnosis or a melanoma diagnosis, you feel very vulnerable because your underlying diagnosis. And you're anxious about the diagnosis, what the long-term ramifications to you and your health. Conversely, if you come here as a young woman who has had small breasts her whole life that she's very self-conscious about, wears baggy clothes because she doesn't want the world to see, she comes here very vulnerable because she's coming to see someone that she doesn't really know and say, I don't like this part of my body enough to take time out of my day to come to you to tell you I don't like it.
That's right.
It's not an empowering position to be in. So we always try to keep that in the forefront of our thinking, and the office, frankly, is specifically designed to try to be a place that's embraces sort of a comfortable experience, because if someone's coming here, they don't really want to be here. There's 500 other things you could be doing 5,000 things that don't involve coming to my office.
Yeah, that's an interesting way of looking at it. All right, so let's move on to injections, because those seem to be like the hottest thing going on today. And, so many people are, asking me questions about them and making sure I was going to ask you guys all about injections. So I know we have Botox and different kinds of fillers. Can you guys explain the difference and where you can do them and how you use them?
Yeah. So there's basically 2 broad classes of injections right now. There's the neurotoxin families, which everyone knows the Kleenex version, Botox. It's the household name because it's the first one around.
Okay.
Botox, Jeuveau, which we really like, which has been around in the U.S. for a little over a year, and then Dysport are the 3 big players in the neurotoxin market. There's a smaller one called Xeomin that very few people use because it doesn't have the longevity. Neurotoxins are good for de-emphasizing any wrinkles that occur in your face when you're animating.
Okay.
So they don't fill holes, they don't fill crevices, but what they do is they will de-emphasize any wrinkle that's created while animating, smiling, squinting.
So like crow's
feet, the
crow's
horizontal lines, the glabellar lines right here, the 11s, the bunny lines.
The two that are FDA approved that are typical are here and here, but they're broadly used to reduce forehead lines, little lines on the side here. It's called bunny lines. You can you can decrease nostril flare if you know what you're doing.
Oh, wow.
You can de-emphasize chin projection or that sort of Michael Douglas chin. Oh yeah, if someone has a gummy smile, you can drop their lips a little bit.
You get a subtle brow lift with it as well.
You can get rid of vertical lines in the upper lip very easily. It's not permanent, but you can get rid of them.
Jawline slimming?
Yeah, if someone has an asymmetric jaw or one of their masseters is larger, you can reduce the size of that with neurotoxin.
So it can be used a lot of different places that people want.
If you want to open someone's eyes up a little bit, you can open their eye by hitting just a tiny little dose below the limbus, below the pupil. I mean, it's extremely versatile.
Even platysmal bands, the banding in the neck that
really
become more prominent.
And then the fillers, there's a bunch of different types of fillers, quite frankly.
Okay.
Our practice uses exclusively the hyaluronic acids because it's a natural constituent of your skin. It's very reliable, and it's also reversible. If you run into a problem or you don't like it, we have a medication we can inject that makes it go away. And fillers can be used for just about anything you can possibly imagine. You can get rid of tear troughs, you can de-emphasize nasolabial folds, marionette lines, pre-gel sulcus, you can increase the quality of the jaw, the angle of the jaw, you can get rid of temporal hollows when people get older and lose fat. And you can do, they call it a liquid rhinoplasty, but you can very easily disguise and diminish asymmetries and things in nose from something as simple as a little bump on the nose to nasal trauma. You can elevate the nasal tip, you can widen the nasal tip, you can give more nasal tip projection, you can decrease it's
unbelievable.
Filling through the cheeks, if you fill through the cheeks, you can actually get a mid-face lift. I mean, it's extraordinarily versatile.
Unbelievable.
And quite fun.
So if somebody comes in, new patient comes in, and they just say something general to you, like, I feel like my face is sagging and I want to try injections. Will you tell them what you see, or do you want them to tell you?
I will not tell them what I see specifically for two reasons. One, I'm specifically trained to look for certain things that the average person walking in my office is not.
Okay.
So I may see things that you don't even know are there, and if I start pointing them out, I may make you more self-conscious about something you didn't even know you should be self-conscious about.
Exactly.
Oh, okay.
Plus, you have to go back to the old thing we talked about earlier. The only person who doesn't see your face in 3 dimensions is you. So how you appreciate your face is different than how I do. And the other issue is my aesthetics aren't yours. So
right.
I may be the guy who's the expert in plastic surgery, but I'm not an expert in what you like. So what I tell people is, don't ask me my opinion, don't ask me what I think, because I see you differently than you do, and you might like Craftsman homes, I might like a Tudor. So what I see is not really relevant. I tell them, tell me the things that you don't like and what bothers you, and I can tell you the ways to fix, improve, or correct.
Okay.
And that's the way I always do it.
What if they say anything else? Is there anything else while we're here? I mean,
so what I will typically do is I tell them, I'm like, look, if you're looking at the cosmetic endeavors of the face, there are 3 things that you have to consider. First and foremost is quality of the skin, right?
Okay.
It's the paint on the outside of the house. If the
Okay.
paint doesn't look good, doesn't matter if the structure of the house is awesome, it just doesn't look right. So one of the first things is getting someone on a reasonable regimen that they can manage. And we work with a compounding pharmacy who's made multiple products for us specifically to make it easier and to address the issues of skin. The second thing that you have to deal with in the skin is the soft tissue elements. Fat pads, muscles. You can de-emphasize muscle action with neurotoxins. You can augment fat pads with filler. You can recreate and reshape doing that. And then the final thing is the bony architecture, which is the hardest thing to fix because that requires physical surgery. But you can blend away a bony abnormality if you're slick with fillers. You can de-emphasize, or if you have an area here that's kind of prominent, you can feather around that area to take away the prominence.
Wow.
There are so many different ways to handle it.
So do you think that all of the fillers that are available today and just the latitude of what you can do with them, is that going to sort of make facial surgeries sort of a thing of the past, do you think?
Absolutely.
It's decreasing it already. It's the other thing that we do here a lot of is facial fat grafting.
Facial fat
Fat
grafting.
grafting.
Because we talked about that, I remember, for the scar one. So tell me about that.
So what fat grafting is, you do liposuction with a smaller cannula. Instead of throwing the fat away, you prepare it at the back table and you inject it just like a filler.
Okay.
Typically 60-80% of the fat will survive. Well, if you do, it's your own tissue, and you have a permanent filler.
Really?
The problem with a lot of the fillers, and many of my filler patients ultimately go into fat grafting, because filler will last for 12 months to 18 months depending on the filler. Well, usually, people don't want to keep coming back every 12 to 18 months and opening their purse or pocketbook or wallet or whatever. But fat grafting, let's say you get 70% to survive. A 70% improvement is a permanent 70% improvement. So a lot of our patients will ultimately go to fat grafting, and fat grafting will mitigate a lot of the surgeries. And if people are more attentive to their skin and continue to take good care of their skin when they're younger, there'll be less wrinkling and sagging later. People aren't smoking as much as they used to, which is also horrible for the skin. Mm-hmm. The trend in plastic surgery over the last decade is to be less and less in what's called the ablative world, meaning using a knife to move stuff, and more in the subtle contours, starting at a slightly younger age, but doing little touch things so that the world doesn't see you differently. Mm-hmm. Our goal here is, if we do any cosmetic endeavor, whether it's surgery or otherwise, I want you to look like a refreshed version of yourself, not somebody else.
Is there, and speaking of that, I lived in Miami for 15 years, and down there, plastic surgery was like a part of life. I mean, just everybody does it from A to Z. The body, the face, everything. And I would see so many women there walking around looking ridiculous. I mean, just
Agreed.
Their lips are just, what happens there? What's going on?
I tell people all the time, the 3 cities in this country to get the worst plastic surgery is Miami, New York, and LA. Because 1, there's intense competition.
Okay.
2, the cost of living is wildly high.
Yeah, it is.
And you can't really charge any more for the filler in Miami than I can here, because it's a set cost when you buy it. Mm-hmm. So people in those bigger cities, they have to actually not just do what's best for the patient, they have to do add-ons. Like, oh, we're doing a little filler here, we need to really be adding here, and we should probably put some to the lips to keep you symmetrical. And you can sell that load of BS, and people will often buy it. But the practice is forced to do more because your overhead is...
Yeah, it's huge.
One of the reasons I left New York and came back to Pittsburgh, primarily is my family and I'm from here, but the cost of living between living and running a business, and the average overhead for a plastic surgeon in 2008 when I left was between $500,000 and $600,000 for overhead alone.
Oh my God.
That's a lot of breast augmentation. That's a lot of lip filler. You can't pay bills by doing 1 cc and half cc in the lips and a little bit in the cheeks. You got to 3 or 4 cc's, and so when that happens, the overdone look becomes the reality. Yeah. And then it becomes sort of in vogue. It's like, not only can I live here, I can afford to do all this.
It looks horrible.
And I think it goes back to too that patients will kind of fall down into the rabbit hole of, oh, I got a little filler, I really like the result, let's go back and get more because more has to be better. More is not better when it comes to aesthetics. You want to, of course, correct what bothers them, but keep it looking natural. So that's when we will have a conversation with patients. Like, for example, the tear troughs is a great example.
Okay.
You never want to overfill or overcorrect the tear troughs because it looks unnatural.
So what is the tear trough? Is this
little guy down here under the eyes?
Under the eyes. Yeah. Okay, that's the tear trough. Okay.
And so, people will have it corrected and they will really like the results. And then they'll, do I need a little bit more? Well, if we keep chasing it and we overfill you, it's not going to look normal. And people will know that something was done.
Yeah.
Okay. Hence the people in Miami.
Yeah. My wife jokingly has called me Dr. 9021 No forever. Because people come in and I routinely tell them, I'm like, no, you don't need that. It's not going to, A, it's not going to achieve the result you want, and B, all you're doing again is an unsolicited donation to my kid's 5 to 9 plan. I really appreciate it, but I realize, so I do tell people a lot that no, this is not really going to be to your benefit, so let's not do it.
Like, when is enough, I guess? You have to, and that's a hard line to draw, especially since you guys are so patient focused, that you want to hear the patient, but you also want to draw a boundary that they understand.
So that's, that's why I tell people plastic surgery, which while I love it, is a potential field of abuse. You can prey on insecurities.
Absolutely.
Or you can say,
Amen. That is so true.
And if you want it, you'll find someone that'll do it. And like I said,
Absolutely.
what they will always say is, well, he's not good enough. I'm an expert, so I can provide the result. And you are likely not to get a result that's any better, but you're likely to have less money, and then you're going to be unhappy because you're going to look a little funny, and then.
It reminds me of Katie and I were talking earlier of like when I get couples in for counseling and the husband or the wife will like call me first and they're like, hey, we're coming in today. You need to tell my wife, blah, 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 blah. And
you're sitting next to her. Yeah. You tell her.
And not only that, like you're not the therapist, I am.
Yeah.
But you want to be client focused in my field, patient focused in your field, but then there are sometimes boundaries that you have to set with your patients.
There are. So what this comes to mind with a woman from a couple of years ago. She likes the really over augmented breast look.
Okay.
I don't like the over augmented look, and actually, as a practice that doesn't really advertise, my work is my advertisement.
That's right.
So if someone's walking around way overdone, 90% of the discretionary women in the world are going to go, he's off the list.
That's right.
And so she literally said to me, she said, all of your augmentations look so natural. I said, thank you. And she said, don't you have any that are overdone? And I said, no, in fact, I don't. And she said, what if that's what the patient wants? I said, well, then I'm not your surgeon. I said, I can give you the names of plenty of surgeons who will put a basketball in if that's what you want, but I'm not going to be that guy.
That's right.
And she was upset that I was not willing to do it. And I said, look, I have to have my own principles here. And frankly, she was a very frail build. I'm like, if we put the implants in that you want, you will be boob forward. They will come into rooms like minutes before you do.
Oh, wow.
So,
oh my goodness.
I very much have that Mason-Dixon line where if it's,
I think it's important when you're a healthcare professional, we have to have nice and firm boundaries with patients because otherwise it can get really out of control for us.
Yeah.
And I think education's a huge thing too.
Is.
I mean, patients, you brought up the patients coming in and kind of telling us what they want done. What a lot of people don't realize is that sometimes if you want to correct something, you're not directly correcting that. Like for example, if you want to make the nasolabial crease look better, sometimes it takes injecting in the cheek to give the cheek a little lift. So it's all about education.
And then you missed, if you do it that way, you don't get the chipmunk look where someone smiles and they don't have a fold anymore.
Got it.
So you want to make patients understand why we do things the way we do, and so we spend a lot of time talking to them before we ever touch them.
Well, I know that, and that's why I wanted so badly to present you guys to the audience and just highly, 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 highly recommend these guys. Katie, before we finish up by just answering a few questions, because I know the screen's buzzing here, can you tell us all about you have a whole project going on here in otoplastic surgery, and I want everyone to hear about what your role is and what you do.
Sure. So as his surgical PA, I can assist him in surgeries. How that's helped me over the years is, like he was kind of touching upon before, I can take things I learned in surgery and use them here in the office for things like lesion removals, non-cancerous and cancerous lesion removals. So I take off a lot of moles, skin cancers. Also, we do a lot of laser here, and with our multi-mode laser, we can do hair removal, tattoo removal, skin resurfacing to tighten the skin and shrink the pores. Also, pigment correction. Also, we obviously do injections of neurotoxins, the fillers, the Kybella for those who may be a good candidate for it. Chemical peels are available, skincare consultations. So we try to include it all. Yeah,
You got it all going on here.
Because it's important for us that things be done right, and patients understand what they're getting themselves into. And so that's why we at least want to have our hand in all those different areas.
Things. Yeah. So basically, otoplastic surgery is your one-stop shop. I mean, if whatever you're looking to improve upon, you need to come in and consult with Dr. O'Toole and Katie.
In fairness, there are some things that we know are outside of our sweet spot.
Okay.
So, but the thing that we know as medical professionals is we know the people within the medical world. So we know whose sweet spot it might be.
Okay.
So one thing we can do is if I see a patient, the one benefit that Katie and I have as a very busy practice is we're not like those people in Miami and New York that are up against the gun whether or not we're going to make our rent. So if something's not in our wheelhouse and it's not something that we really enjoy doing or something we think we're if not the best, certainly qualified with among the best.
Okay.
Then what I do is I pick up a phone and call one of my colleagues where it is in their wheelhouse. I recently saw a young woman who's the daughter of a friend of mine growing up. She had a nasal problem that it requires extraordinarily complicated surgery. It's not a simple cosmetic rhinoplasty, which I do all the time.
Okay.
I talked to him and I said, these are the things that are going to need to be addressed. And I said, I'm going to call a colleague of mine who does this and only this and nothing else, because he's the guy you need to see. Because So I called him, he saw him, they were on the OR schedule with him last week.
Wow.
So the other thing that we as a practice will do is if we see you, even if it's not something we're going to physically take care of, we know who to get you to so you get to the best person.
Right.
Absolutely.
And that carries a value for the community
It sure
in and of
does.
itself.
It says a lot. And I think that can really assure, anyone who's watching and has maybe been thinking about trying something out, or wondering, what is all involved in something they're thinking about, to come in and consult with you guys. You don't have to come in and do something, right? I mean,
Absolutely.
you
No,
just
there's
can come
no
in
pressure.
and schedule just a consultation
talk,
and just
yeah.
talk.
Yeah.
And
the way we run our practice, if you come in for consultation, we're not going to push anything. It's just not how we...
no, you don't.
And if you decide you want to do that thing that we talked about, that consultation fee that you paid to us to come in that time comes off of the cost of what we were doing anyway.
I see.
So it's to protect people. It's also to protect our time. We could spend hours and hours explaining things to people. But
Like you are today. Thank you very much.
yeah, I mean, it's
fun.
the more educated a cosmetic consumer is, better. Like the higher the likelihood they're going to have an outcome they want.
Yeah.
And there's frankly a lot of people out there doing stuff they probably shouldn't and doing things for the wrong reasons. And the more educated a patient is in the front, like we do a lot of revision work, not just breast cancer, but breast augmentations, reductions, and facial work. And we've heard at least 1,000 times, if I knew you were here before, I would have avoided all this, and I would, which is frustrating.
It is, but
And we keep up with education ourselves. I mean, we're constantly looking into new techniques, and that's something that's really exciting too, because there's always something new in cosmetics and aesthetics. You just have to stay up on it. You don't want to be practicing things people were doing 15 years ago, because odds are there's a better technique out there that would...
There's no doubt.
Yeah.
Wow.
So
it's hard to keep up
yeah,
with.
you got to keep up with it, and that's
It's
something
fun
we
to
really
keep up with,
focus
though.
with. If you love it, which we do, obviously, it's easy to keep up
Yeah. So I'm going to check out our screen and see what kind of questions viewers are asking, if they're asking maybe some things we haven't covered really quick. So
Absolutely.
let me just get up here, and I will put my glasses on and just try and read what we have going on. Hello, everybody who's watching. Cheers, Miss okay. What advice would Dr. O'Toole give to young girls and boys in regards to self-esteem and social media? Wow. Okay. That's a good question.
The most important advice that I would give to parents and the young boys and young girls is realize that what you're seeing is, first of all, an international pool of people. So it's not a local comparative. The other thing is the pictures you're seeing are the best possible representation of themselves and not an adequate representation of who they really are. So don't compare themselves to them. The other thing I always tell, and I tell my own kids this, you have to compare yourself to the best you possible, not to somebody else. For example, if you're 5'6" and you want to be a power forward in the NBA, you're not going to be a power forward in the NBA. It's just not going to happen. So you have to find the best version of the 5'6" you that you can have. And it doesn't mean comparing yourself to somebody else. It's hard for parents to get this through to children because the children don't want to hear it. We do a lot of that here at this office. And the big thing is, and I literally do it myself, I take pictures of when I was a very serious triathlete, and I literally will show them, this is a picture of me, but it's not an accurate representation. Right now I'm an older guy with 2 bad knees. So that's one of the things we work on a lot. And when they hear it from an external source, I think it really helps quite a bit.
Someone's asking, does liposuction work on cellulite?
Liposuction does not work on cellulite well, and the reason being there are 2 layers of fat. There's the deeper layer and the more superficial layer. The superficial layer is what causes the cellulite, and if you try to do liposuction there, you actually can increase the complication rate and the cellulite, actually.
Oh, wow.
So hold on with that question, though, because recently, within a month or 2, the FDA just approved its first injectable medication ever for the treatment of cellulite.
Yeah.
So I would say Not time to jump on that bandwagon yet, but wait about 18 months until people figure out the ins and outs. But there's a new medication that was just approved for the treatment of cellulite, and on the FDA labeling it says 80% improvement with serial injection.
Wow.
So that's coming down the pipe. It's not here yet, and don't be the first patient. You want to be at about the 18-month mark.
Okay, never mind. Don't sign me up. Okay, I have been seeing KADIE for the last few months, and I have to say she has completely changed the look and feel of my skin.
Oh, yay!
And on my face, neck, and chest, it has been a wonderful experience. Thank you.
Oh, thank you, whoever that was.
Is there any bruising with injections?
Very infrequent with the neurotoxin, except right here on the lower corner of the eye. This area tends to bruise a little bit. Bruising is more common with the filler because the needle has to traverse the area. Now that being said, the deeper filler injections like the cheeks and the way we inject the nasolabial folds, bruising is very unlikely. We do tell people if they can, from a medical perspective, stay off all NSAIDs and aspirin products. But bruising is something that we tell people to expect more with filler. It doesn't always happen. We use more of a deeper injection technique. Specifically because that's where the fat that you're replacing really lives, but also the visible bruising is much less likely.
I'd say the one area where bruising is a little bit more common is under the eyes, and that's because the skin is so thin there. So just make sure you avoid your blood thinners 2 weeks ahead of time. We utilize topical numbing cream and ice to get you as comfortable as possible. But it is a possibility. It's one of the risks.
And the bruising is rarely anything that can't be covered with a little foundation.
Yeah.
Right. Okay.
If you're a guy that doesn't wear foundation like me.
I tried. I thought maybe you might want a little more. The camera kills you, but you know. Okay, so in our last question up there was any advice for scar enhancement. I know a lot of some of the emails I got in my box yesterday about you guys being on were women that were considering doing breast lifts or breast augmentation or even breast reduction, but they were concerned about scars, and of course, scarring can be a big deal.
Yeah. So the thing that we recommend the first and most important thing with any scar is scar massage. The active scar massage causes blood vessel dilation. It increases the rapidity of healing. It decreases the time that the scar is in what's called the inflammatory phase. So scar quality is better. We like to use a prescription compounded pharmacy gel called Pracasil, Pracasil. It is prescription only. It's a naturally occurring tea tree oil from South America in a very fine medical grade silicone gel. It's been shown to improve scar quality 85% of the time.
Oh my, that's bad.
So we use that a lot. We have a compounding pharmacy that we deal directly with. You get it directly from the pharmacy so that we're not a middleman who says we're going to charge you $4 extra because it's on that shelf. And then the next step up from that is our fractionated laser is extraordinarily good at dealing with scarring and improving scar quality. But that's like the howitzer.
Yeah.
Okay.
You start with the basics first.
Yeah, and see where it goes.
But it is really impressive. I mean, one quick little short story I have to share about our laser and scarring. We had a patient whom, unfortunately, she had a mastectomy elsewhere, and for whatever reason, they closed her skin with staples, and she developed keloids.
Oh,
and she had
little dots of very staple.
she had terrible scars on her chest. She had great shape and form, but the scars were terrible. We did her revision, but anyway. So, of course you try to correct the scars as much as you can with the topicals and the massage, but we ended up doing the laser on her for her keloided scars, and it really improved them. It helped flatten them, soften them, and it helped improve the color. Now, they are still there a little bit. You can't make them 100% go away in some people, but the improvement that she got for something that she was so self-conscious about being a single woman, is something that was really fulfilling to just see how...
And the other caveat to all that is protect any new scar from ultraviolet light. Sunscreen between 30 and 50. You want zinc oxide 7.5% or higher.
And they can buy that here too, right?
Mm-hmm.
Oh, heck yeah. We have it on sale right now. Buy one, get one 50%
okay, how about that?
off.
Well, and I know, like, with scarring, when you were talking earlier about how the younger girl was, like, fixating on, like, something about her nose. Well, when I got this dog bite, I was attacked in my face, and I just fixated on it. And I couldn't touch anything because of litigation reasons and stuff for a couple years. And finally we got to do some work on it, but you do hyper focus. And
Well-
the thing you think about is like people go, oh, well, I can't see it. And I'm like, well, 2 years of my life, I didn't have a scar on my face, and I look at it all the time.
So the other reason that happens as well, though, is the human eye evolved over millions of years to pick out asymmetry. That's its best quality.
Really? Okay.
It's not like we have eagle eyes and we can see too far and we can't see through water, but asymmetry, the human eye and the human brain is very good at picking out. And so the human eye will actually be drawn to asymmetry. And so anytime you have an asymmetry, that's usually what people are... More often than not, the asymmetry is what people are drawn to and the reason they come in here, even if they don't realize it's the asymmetry.
Okay.
But that's what the human eye is very good at picking out, is asymmetry, whether it's asymmetry from right to left or whether it's asymmetry to facial structure from the upper third, middle third, and lower third. If there's something that doesn't quite match the other thirds, the eye will be drawn to it. It's
That's
the way
incredible.
it works.
Every time I see you, I learn so much. Every time I do, I try to apply it in my life, in my practice. So I thank you guys for that. So we covered a lot today, guys, here on Liz Live, and we are live at O'Toole Plastic Surgery, which is right on Ellsworth Avenue in Shadyside. So if you were wondering where exactly in the city that we are, we're in Shadyside. Very easy to get to. There's parking, street parking, parking lot. And I know you guys have a presence on Facebook and Instagram.
Yep.
That's something going on. So you can keep up with all the new, I don't know, you guys run specials and different kinds of...
O'Toole Plastic. We just started the Instagram page. Nicole, our nurse, she's not here today, but she's largely taken part of that, and she's doing a great job with it. And it's a great way to show our before and afters, because that's one thing everybody wants to see, your before and afters. But we also, show our staff, show the office and products and sales we have going on too. So it is newer. There's not a lot of content on there yet, but there will be.
Okay.
So keep an eye
And
out.
all promotional stuff will be through social media.
Through social media.
Yeah.
Okay. So definitely make sure you look up O'Toole Plastic Surgery on Facebook and Instagram. And I'll make sure that I provide links to all of that, guys, on my actuation counseling page. And, plastic surgery is serious business, whether you're getting an injection or you're getting, you're actually getting surgery. So you want to make sure that the person that you choose is ethical and really cares about how you make that decision. And, I can't say enough about O'Toole Plastic Surgery. And you want to make sure that you go to someone not only who's competent, but someone that has your best interest at hand. I think that's really important.
Absolutely.
I would agree.
Yeah. So that's it for today's show. Thank you guys so much. Thank you, Katie. Thank you, Dr. O'Toole. It was fun. It was awesome. We can't wait to watch the replay
I know.
and see how we did.
First time.
But seriously, everyone, thank you so much. And please look at my page. And if you missed it or you tuned in late, you can watch it on the replay. And I will see you guys back here on Thursday at 1 o'clock and Saturdays at 11 a.m. Thank you for watching. You're watching Liz Live. See everybody on Thursday. Thank you. Bye-bye.